All right. Good morning, Adam. I see that you're on the call now.
Good morning. Thank you.
Hi.
Hi, good morning.
Yes, thank you for being here. So we've still got about 2 minutes until the call is slated to begin. So we'll just wait for some folks to hop on. But for now, just want to welcome everyone who's hopped on so far. It's good to see your faces and names as always. And of course, it's a little bittersweet this Monday since this is one of three final Path Forward calls. We're going to be putting an end to the series after this week. But we're really glad that we were able to get Adam Heinz from REMSA here just before the buzzer. So we're looking forward to kicking off the week with this conversation. And then, of course, tomorrow we have Dr. Thomas Schwenk, who is the Dean of the School of Medicine at UNR. That'll be a great conversation. It's always great to get his insight and expertise when it comes to the COVID-19 pandemic. And then Thursday, we finish things out with a recap of the special sessions of the legislature, the second of which just concluded last week. And we're going to do that recap with KUNR politics reporter Paul Boger. So that's another good one to tune into. As we're closing out the Path Forward series, we're really excited to launch a new workshop series in the fall, which will be a longer format educational opportunities for our members. And I'm thrilled to be working on that for you and have more to tell you about that in the coming weeks. So with that, it's at the top of the hour. Once again, I'm Christine Brunn. I'm the Director of Member Engagement here at the Reno Sparks Chamber. And it's been my pleasure to moderate these calls. We are excited to welcome Adam Heinz with us today. He is with REMSA. And, instead of me starting off a bunch of bio information, Adam, how about you go ahead and tell us a little bit about yourself?
Thank you very much. Good morning. We appreciate the opportunity here at REMSA. My name is Adam Heinz. I'm the Executive Director of Integrated Health. I've been with this great organization in our community for over 18 years in different capacities, starting at the entry level, which is providing care to patients in our community, which I still try to do, and then obviously progressing and wearing different hats from EMS supervisor to our medical dispatch center, overseeing our medical dispatch center, to now I get the privilege of really working with the team that upholds our clinical standards and care, as well as our education division, and really working, which I'm hopeful today we'll be able to touch on a little bit, is the innovations in which we're bringing to here in Washoe County. So thank you for the opportunity. I'm going to go ahead and share my screen so you can see I have a little bit of a presentation, and we'll get started. So one of the things that I am most proud of, and many people obviously know REMSA for our ambulances. We are this community's, Washoe County's community's private, nonprofit, without tax subsidization ambulance provider, and we've done that since 1986. Also, fun fact is CareFlight is part of our organization as well. They actually were here since 1981, so they built the block before we got here. But really, a lot of people identify us as if you need help, call REMSA. And we obviously appreciate and believe that is an extreme privilege to be able to provide that care in our community. But there's a lot of other things that we do. One of the things that people are actually interested in is when they come to campus, they see the depth and breadth, and that starts with our Department of Education. One person in Washoe County every 32 minutes gets trained in CPR through REMSA. And so that really is a testament to the community, which is interested in having trained force multipliers. We call those force multipliers, so that when somebody suffers a sudden cardiac arrest in our community, there's a lot of people that are trained to be able to provide intervention and increase their survivability. In addition, we house the region's medical dispatch center, and what we like to say is care starts with the call. So when you call 911, you get a medically trained internationally accredited emergency medical dispatcher that begins to provide care over the phone while our ambulances are responding. And those life-saving instructions may be chest compressions for somebody in cardiac arrest, hemorrhage control, or talking through a new father delivering a child at home. Every day, they provide life-saving instructions to individuals that are calling in Washoe County, and we're proud of that. In addition, our community health programs. You know, the model of responding an ambulance, lights and sirens across town to pick up a patient and bring them to the hospital is antiquated. And we are really, and I'm hopeful that during today's presentation, you will see vested in trying to innovate the ways individuals access healthcare. And if there is any silver lining to a pandemic, and there really is not, but one of the things that I think has catalyzed the ways that individuals access healthcare right here in Washoe County is the introduction of telemedicine and different response models. Because EMS is the safety net. When a mother that doesn't know what to do at 2 o'clock in the morning when their kid wakes with a fever, 911 is there. And we want to be able to provide the right level of care for the right person compassionately. So that's kind of an overview of our organization. And so we can kind of talk about some other things.
All right, fantastic. Well, thank you for that. I know a lot of folks, myself included, you know, don't always grasp the concept of all of the different range of responsibilities that REMSA maintains in the community, including, you know, instruction, pre-hospital instruction, the fact that you don't get taxpayer support, that you function under a public utility model. It's important to keep these things in mind as we're thinking about the role that you play in the community. So thank you so much for that. So jumping right in to you know, more of the COVID-19 conversation. So right off the bat, what can you tell us about how REMSA's response has changed as a result of COVID-19?
You know, like any business in our community, it is necessary for us to be adaptive, for us to be nimble, and for us to be ready. And, you know, part of one of the things that we like to believe at REMSA is we're always ready. And I think, did my screen stop sharing?
Yes, I took it down for the sake of the recording, but we can put it back up if you need to.
Nope, that's fine. I just wanted to make sure it just had alerted me.
So,
you know, we're always ready. And you know, we learned a lot. Back in the spring of 2009, we saw the H1N1 pandemic hit. And part of the preparation for COVID-19 really is rooted back in that 2009 pandemic that we saw here locally. And that started with our logistics technicians, and they're really unsung heroes. You know, that division ensures that our paramedics and EMTs are prepared when they respond. And they did a fantastic job, enough to where, you know, many health and public safety organizations look to REMSA to provide them supplies early on. You know, we didn't know a lot, and still today we don't know everything. Although some of that has changed and a little bit better understanding. But in the beginning, you know, our crews were having to take protective measures, again, without a ton of direction. We just knew that we were dealing with an infectious process, and we wanted to make sure that our employees remained safe. And that takes a toll. And as we're later going to discuss, you know, this is a marathon. The idea that COVID-19, and I think all of us has that wishful, you know, once we get to the holidays, it's going to be gone. Or once we get that vaccination, it's going to be gone. Although some of those things are going to be true, or at least move us in the right direction, COVID-19 is here to stay, at least for a little short while. And so, you know, with that being said, the health of our employees, not only physically, but also mentally. It's extremely draining being put in a position to respond to individuals that need help. And we're health caregivers. We are helpers. And to respond, but also then to have to think about, what if I bring this home? You know, my wife is pregnant, or my kids are at home. And that stress is something in which we really have been focusing on to ensure our crews remain fit for duty. Obviously we've seen many sick people. We also have seen people that are not sick, and some of those extremes plays tolls. And part of our strategy is how we manage both sets of patients. Both needs need to be serviced, but how we provide that service is different. And we're going to talk about that here shortly.
Great. So what have you noticed in terms of calls for service? I know that I've heard from other healthcare sectors that there's been a concern when it comes to people foregoing an emergency call because they're afraid to go to the hospital, afraid of being in contact with COVID-19. Have you had that same observation with calls for service for REMSA in particular?
Yeah, so I have a graph that kind of shows the story. When we first started, locally seeing patients with COVID-19, in March and April, we actually saw record low call volume. On average, we respond to anywhere from 225 to 250 calls for service a day, sometimes 300, but it was not uncommon during those first couple months for us to actually only respond on about 150 calls for service. So almost less than 100 than we normally do. And, that was something we saw locally, but on a national scale, we saw that as well. And that was because many people were not engaging in activities that they previously would, right? So there's less cars on the street. There's less people that are engaging in activities that potentially could make them ill or injure them. But in addition, there was a fear. And the fear was, if I go to the hospital or if I access care, I may get sick. And so we had to work to get through that. More recently, specifically within the last 8 weeks, we've seen an increase in the number of calls. And we used to have a seasonality. During the summertime, typically we would see an increased call volume, and that usually was related to a lot of special events. And unfortunately, this year, we don't have the special events, but we are handling more calls for service. In fact, the last 8 weeks, we saw what we call a surge. And that essentially is defined as kind of 2 times the standard deviation of what we normally would respond on. That's occurred 20 times in the last 8 weeks. And thankfully, the way in which our organization staffs ambulance through a very dynamic deployment model, we have the resources to be able to handle those surges. In addition, with some of our regional partners to be able to provide the level of care. But really, a lot of that is the catalyst behind the way in which we are going to change the way that individuals access healthcare, and that's through a tiered response model I'm going to talk about here shortly. But as you see, based on the graphical information, we saw a decrease, and now we are starting to normalize.
All right, gotcha. And we've kind of alluded to this already during the call. I think this is something that is not only important to discuss in your context, but it's something that everyone on the call can relate to. And that's the fact that every industry, every sector of the economy has had to do the same thing during this time, and that's pivot. It's a word that is perhaps running its course, but it remains true. Each one of us have had to pivot, have had to innovate in order to keep operations going. And so I'm curious to hear what REMSA has been doing in particular to innovate. And I presume that this tiered response is incorporated in that.
Yeah, absolutely. And so one of the things in which, there are many different things in which we are introducing. And, some of these concepts, although may be novel to us locally, are industry standards across thousands of progressive EMS agencies across the nation. And that is, again, trying to fit the right level of care for the right patients. And we, of course, want to do it safely. And there's different ways in which we can do that. And that includes, an introduction of BLS life support ambulance. And so since 1986, REMSA has had skilled paramedics on every single ambulance. And the difference between a paramedic and an EMT is significant. Paramedics go through they obviously have to become EMTs, but then they also go through extensive anatomy physiology, pharmacology, pathophysiology. They go through hundreds of hours of clinical time. And so typically that coursework is a year and a half before they are able to provide care in the community. And really, we know that paramedics make differences in many patients. You know, we see a lot of care driven by the ability for our paramedics to arrive on scene, identify somebody that's having a heart attack, call the cath lab, and because of the health systems we have locally and the partnerships we have, we call them, they activate their cardiologists, and we directly transfer the patient into that cardiologist's hands. And, you know, when we're talking about life and death, minutes matter when it comes to the brain and to the heart. And so that's a lot of what our paramedics do. And the premise of some of these system enhancements is a lot of the calls in which we're seeing are for cold, cough, fever, chills, low acuity complaints, obviously endemic and not unique to this city, but obviously endemic is behavioral health psychiatric emergencies. And so we would like to pair skilled providers that can provide the appropriate level care so that our paramedics are available for those patients that are experiencing the stroke, the chest pain, the pediatric drowning. And so that's one way that we can do that. In addition, there are a lot of calls in which you see ambulances responding lights and sirens. And, you know, there actually was just a paper that was published recently that talked about the number of times an ambulance responds to a call emergently. And in fact, in this community, every year we review that because we don't take it lightly. The privilege of being able to go through an intersection with lights and sirens and have people pull over, there is an inherent risk. There's a risk to our responders and there's a risk to the community. And so we don't take that lightly. So every year we review those with our medical directors. But there was a paper recently published by the National Association of EMS Physicians that suggested that there are many times we go lights and sirens, but only a few times do we actually provide life-saving interventions. And so part of our system enhancement is to align or maybe realign the number of times we go emergent to calls so that, again, it is for those emergencies that we know time matters and that the risk outweighs or the benefit outweighs the risk. So that's one of the innovations. And then finally, the other innovation that we're really excited about is our quick response vehicle. And this is really going to elevate the standard and the level of care that's provided to some patients. So these quick response vehicles, which are currently deployed in the county now, they will respond to certain call types. And it's a spectrum. Again, when I first started, we have patients that are in grave need of medical attention. Thankfully, those are the minority in the number of calls we respond to per day, but they are out there. And then there is a majority of patients that don't necessarily need those type of services. And so the quick response vehicle will be staffed with an advanced care paramedic that has an expanded scope of practice, has additional tools in their tool belt. They'll have video laryngoscopy, they'll have ventilators and pumps and medications, so that when they arrive on some of these very sick individuals, they can elevate the level of care that's being provided, work with our already either on-scene or co-responding advanced providers, and be able to provide the appropriate treatment. In addition, those units will be available. There are many times where we respond to calls. An example is one this last week. There was a vehicle that was on fire, and the fire service responded, and they were focusing on putting out the fire. And the person that was inside the vehicle was not injured, thankfully, but they had to wait for a ride. And that person was coming from a distance. And so it was 100 degrees or near 100 degrees that day. And so instead of having that person wait in the back of an ambulance, tying up that ambulance, our quick response vehicle responded, allow that person to sit in the air conditioning of the back of their vehicle and freed that ambulance so that they could be available for transports. And really, you know, some of this stuff, again, it seems sensical, but for so long we were just tied to a paramedic has to respond lights and sirens to a call across town. And we really want to change that perception from the public standpoint and from our partner standpoint, that we can do this safely and innovatively, and we need to.
Right. No, that's fascinating. That's fascinating to hear about. And I know, this is clearly, in addition to, other innovations that are happening in the community. I know drone technology is something that, we're looking to integrate into our emergency response system, the delivery of AED machines, before first responders can arrive to a scene. It's all so interesting, and it's interesting to see how you and your organization are thinking through proportional and efficient responses, in order to streamline the process and allow the right applications of the right tools to go to the right people. That's great to hear. So we know that fall is on the way, and right now we're widely considered to be experiencing the first wave of the coronavirus outbreak. And we're told, and have every reason to expect that there could be a second wave in the fall. And with that comes concerns over flu and other bugs that arrive seasonally and rear their heads around this time. What would you say REMSA is doing to prepare for that seeming inevitability?
So if anything, and probably most important for everybody, it's kind of a shameless plug, but everybody needs to get their flu shot. REMSA Health partners with the Washoe County Health District. And again, this year we will do that to provide access to those that are in our community that are homebound. So we provide at no charge to the individual access to receiving the flu shot to a vulnerable population. So I think that's important. But in addition, we've got to do our part. As I said, COVID's not going away, and it's going to be even more complicated with influenza in the community. So if we get our flu shot and we decrease the number of people that potentially contract the flu or have the severity where they need to utilize the hospital, utilize the EMS system, we again preserve resources for those patients that are still experiencing COVID. So very important. Almost as important is the health of our employees. These are the men and women that are on the front lines providing care to our community. And again, this is a marathon. And so some of the stuff that we have done to ensure that they are prepared and ready is obviously, as we're talking now, some of the innovations, the proactive approach to managing what's next, always ready. We deployed a mobile employee health screening tool called Vivify that checks in with our employees every day, make sure that they're feeling well. If they have any symptoms, it gets reported to one of our screeners, and then we obviously take the appropriate steps. In addition, we've changed our employee uniform procedure. Like I said, many of these employees, they want to help. They're caregivers, but they also are family members. And so we very quickly developed an employee uniform process where we partnered with a professional laundering service so that they can change their uniforms here, reducing the potential for contamination. And then we professionally launder them for our employees. We have, and this is something that I think is really cool, the community not only has helped us, but also REMSA has invested in healthy meals for our employees. And so, early in the pandemic, a lot of the places in which our employees would potentially get food were closed. And so we partnered again with a local company that provided healthy, ready-to-eat meals for our employees. And those are still available to this date so that we know they have something to eat. We matched and exceeded the CARES Act. And so interestingly, REMSA doesn't actually fall within the guidelines as far as an entity that would follow that, but we decided that it is in the best interest of our community employees to exceed those standards. And so if somebody, whether that be a family member or an individual, comes down with COVID or a COVID-like illness, we provide the ability for them to have time off. And we pay for that so that we ensure that they aren't coming. There's no pressure for individuals that are sick, which we're seeing across the nation, to come to work. And then I'm also pleased to announce that, we've had 134 employees that have had either an exposure, whether that be on duty, an accidental exposure on duty. Many of them happen off duty, and obviously many organizations across our community are managing that. But out of 134 employees that we have monitored, only 4 of them actually contracted COVID, and some of those are traced off duty. But it really provides a highlight and a testament to the procedures that we have put in place and to the efficacy of personal protective equipment.
Right. I mean, that's a great segue into the next question, honestly. And first of all, it's fantastic to hear about the ways the community has stepped up and gotten involved in that. A lot of those measures are still in place, that, you know, your employees are getting healthy meals. The people who need it the most are getting the care that they need, and that you're going above and beyond to do that. And that's very exciting. And we do thank you. For those of us who are beneficiaries of your services, we are grateful that your employees are getting such good care. But what can we as the business community do to continue to support your efforts?
So first, the generosity of this community, I mean, without asking, and you know, I have to acknowledge that these businesses, many of them unique to Reno, many of them small businesses within our community that were likely hit the hardest when there were closures and when people were no longer going to eat out, stood united with healthcare workers and provided meals. They came to us and said, "What can we do? We can cook, we can provide money, we can." We've had professional seamstresses, you know, making masks for us and for our crews. It's just, the generosity is so heartwarming, and I know that our crews are so appreciative. And you know, it's difficult. Like I said, as a private nonprofit without tax subsidy, you know, we rely on our community and different things to ensure that, you know, our ambulances have the latest and greatest equipment. Our employees are paid competitively for the risk that they inherit. And so, you know, if there's anything that people want to do, obviously our public affairs manager, Alexia, is out there. We have a place on our website that allows for individuals to come and donate, whether that be monetary or non-monetary things. You can go to remsahealth.com/donations. In addition, one of the things that I think was driven out of this is a page in which individuals from our communities, community members or patients, can actually go on to REMSA's website and they can fill out a thank you. And those thank you sticky notes mean the world to many of these individuals that never have an opportunity to follow up with a patient and see how they do. It's one call to the next call, and each individual receives this follow-up that says, you know, hey, thanks for what you do. So we appreciate the community support, and we appreciate the generosity that we've received.
Absolutely. I mean, you learn something new every day. I had no idea that you could actually donate directly to REMSA from your website. So that is good to know. And I hope that many of us will take advantage of that in order to make sure that you're supported through this time, and that the innovation can continue. And I think, you know, we're coming in on the close of the call, and just want to say thank you once again for being here, Adam. And for those of you on the call who have questions, now is the time to get those in. If you have anything to ask, in particular, go ahead and put it in the chat, and we will get to it here in a second. But my last question, you know, is in regard to the future, which of course is still being written in a very dramatic way. But what would you say today? In what ways would you say today that REMSA's operations have forever changed because of the COVID-19 pandemic?
Well, again, I appreciate this path forward theme, because that's what we're focusing on. We are focusing on being proactive and moving forward. And the future of out-of-hospital healthcare is here. It is here in Washoe County. And within the next few weeks, during a phased rollout, we are going to see more appropriate level responses to appropriate patients safely. Already in this community, you can receive telehealth visits. We partnered with different agencies to be able to provide a responder to go to home, and you don't even have to leave, and we can get you access to a healthcare provider, a physician that can write prescriptions, order labs, order diagnostics, so you don't even have to leave. Quick response vehicles. And I think, again, you know, healthcare is changing, and if we aren't nimble, if we aren't able to pivot, or if we aren't agile, we're behind the times. And I think here in Washoe County, we are the future.
Great. Thank you so much for joining us. And again, I'm not seeing any questions coming in with chat, which just means that we did a great job, Adam. So thank you. Thank you so much again for joining us, and thank you everyone on the call. Again, even though we're closing in on the end of the Path Forward series, these matters are still important, and we're still going to keep our finger on the pulse of the ways that different industries and sectors of the community are carving out that path forward into the future. And thank you so much, Adam, for sharing your thoughts and views and the work that you're doing at REMSA. And Godspeed to you as you continue. And hopefully, some of us on the call will be inspired to write a thank you or even to donate to REMSA. So thank you for opening up those inroads for us too.
Thank you.
All right. Well, thank you so much, everybody, for being here, and we will see you tomorrow.